Hi, welcome to our presentation of findings for the Community Mental Health Fund. This is a brief assessment of organizational activity that the Community Mental Health Fund has been engaged in, specifically in three areas. Their operational performance, or the quality of the interaction that the Community Mental Health Fund leadership and staff have had with the agencies they interact with. The second area is their value-based payment initiative. And the third area is a brief assessment of how the community agencies who are served by the Community Mental Health Fund are accessing and incorporating social determinants of health and racial equity into their agency practices. I am Jody Brook, and I am a community engaged researcher and social work educator, and I served as the lead researcher for this activity. I am joined by two individuals. The first is Dr. Kylie Liming, who is a community-based researcher, and her work centers on childhood adversity, adverse childhood experiences, and early childhood risk. And Sophia Mazzetti, who has a master's degree in public health with a specialization in epidemiology. And Sophia worked with us specifically around social determinants of health and racial equity. So I'm going to get started first today by introducing you to the study that we conducted, and then Dr. Liming is going to take it from there. All of our videos are going to be broken up into the three areas. The first one being operational performance, or the quality of professional interaction. The second one will be the VBP initiative. And the third will be the brief assessment of social determinants of health and racial equity. So I'm going to go ahead and get started and provide you all with an overview of what the entire study looked like. Sorry, let me just expand my screen a bit. There we go. First of all, in terms of an overview, our study used a planned mixed methods design where we used quantitative approaches, such as survey methodology, and paired it with qualitative approaches, which is we used some very open-ended questions in the survey to solicit more detailed responses than we can usually grab in a survey instrument. And then as a follow-up to these open-ended questions, after we computed all of our survey data, we sequentially then engaged in community conversations with 8 individuals who are active members of the Kansas City community and part of one of the 3 core areas that we were assessing. So this is called the sequential data collection approach, and we used this purposefully. Next, again, we paired it with this survey that has closed and open-ended questions and key informant conversations in all 3 of our areas. We collected and analyzed this information using 2 pieces of technology that were incredibly helpful. The first, REDCap, for our survey analysis, and that is our survey deployment and keeping all of our data was REDCap, and those were for our closed-in questions, and then we used Deduce for our open-ended questions and our interview notes. In terms of respondent demographics, I first want to say that we had 107 individuals who were pre-identified by the staff and leadership at the Community Mental Health Fund as individuals that we should survey. And between October the 10th and October 25th of 2022, we deployed the survey. Of the 107, we had 61 fully completed and another 10 that were partially completed. So you'll see the number 71. This is really considered our sample for the study, but that number can vary depending on how many people may have answered or not answered a particular question. So of those individuals, about 69% identified as female, about 30% identified as male. In terms of racial category, the overwhelming majority of our respondents were white, followed by African American, followed by other, and then followed by multiracial. In terms of job role, the majority of the respondents were in an administrative role. And we also had a category of those who were providing direct clinical supervision, but did not actually have a clinical practice. So that's also an administrative role. And that was a high category for us as well. So by and large, what we're looking at here are most responses are from those who are at the administrative level in an agency. And then time in the current role, we had kind of two ends of the spectrum here. We had about 27% who had been in their roles what I would consider a short period of time, which is 1 year to under 3 years. And then we had another very large group, about 25%, who had more than 10 years experience or time in their current role. So, so this is what our demographics look like for the respondents that you're going to hear the information as we go through our study. So I'm going to turn it over to Dr. Liming now and allow her to share her screen for our findings from operational performance or quality of professional interaction.
Hi, my name is Kylie Liming, as Dr. Dodie Brooke mentioned, and I'm going to be presenting on the quality of professional interaction. The objective of this domain was to assess CMHF's maintenance of a respected, smoothly functioning, and professional organization. The questions within this domain centered on 3 main topics regarding the respondent satisfaction with the quality of experience with 1, CMHF overall, 2, with CMHF's funding process, and 3, CMHF's billing and payment processes. As Dr. Brooke mentioned, this information was collected via closed and open-ended questions in the REDCap electronic survey, along with combining some of the qualitative findings from the 8 qualitative interviews that were conducted. The figures that I will be presenting on in this presentation are really a summary of all of the questions that we asked in the electronic survey, and the responses have been condensed for both clarity and parsimony. If you are interested in the full results and wording of the survey questions, those are available in supplemental tables and in our full report. If you wish to review those, please feel free to request them. They are available. This slide illustrates the respondents' overall experience with CMHF. So the condensed row titles that you see on the left side of your screen correspond to the 7 survey questions in this respective section. Both the number of respondents and the percentage of total respondents who answered strongly agree or agree are presented in this figure. Our findings show that 100% of respondents strongly agreed or agreed that CMHF was responsive to their agency issues or concerns, that their CMHF liaison is accessible, and that CMHF acts professionally and operates smoothly. Between 94% and 98.5% of respondents strongly agreed or agreed that CMHF addressed and answers questions in a timely fashion, that they are respected by the CMHF personnel, that CMHF demonstrates interest and concern for their agency's clients, and that the CMHF effectively collaborates with their agency. Overall, these findings are really exceptional. Next, we had administered 4 survey questions that focused on the CMHF funding process. Again, this figure above details the number of respondents and percentage of total respondents who either answered strongly agree or agree. Also, for clarity, we have included the small frequency of individuals who answered neither agree or disagree, which is represented by the yellow shaded area. Overall, a very high percentage of respondents strongly agreed or agreed that information about CMHF's funding application process was easy to access, with 89% responding that. CMHF's funding process has been fair. 97.1% responded that CMHF's funding process is transparent, and 91.5% responded that their agency has the capacity to do what they're contracted to do with CMHF. The next section of questions focused on billing and payment, which consisted of 9 Likert scale questions. Though very minimal, this section and grouping of questions, we observed the greatest variability in this domain, and that's largely attributable to the number of respondents who replied either neither agree nor disagree, which is highlighted in the light blue. And then also, neither agree or disagree is highlighted with yellow, and then NA and unsure is the highlighted in light blue. Overall, the responses and results from the billing and payment survey questions revealed that 72.7% and 90.9% of respondents strongly agreed or agreed that the billing and payment processes were clear and understandable, aligned with their agency's needs, have clear service unit definitions and instructions for reimbursement, allow for flexibility in addressing reimbursement issues. Also, the billing and payment has an accessible list of service units, billable services, and an identified person to contact with questions about service units, and that they feel that they receive timely answers to questions about service units. And lastly, the billing and payment processes do allow for easy reconciliation of issues. I will finish up by presenting the qualitative findings. These qualitative findings are a summary of the findings that we found in the 8 open-ended survey questions that were administered through REDCap, and then also from the 8 individual qualitative interviews. The qualitative responses were analyzed and deduced, and this slide details the main qualitative findings. Overall, we found that survey respondents repeatedly noted that flexibility of funding was beneficial in helping grantees to improve and deliver services, and that survey respondents appreciated that CMHF operates in a collaborative and supportive manner. Though not attributable to CMHF, numerous responses also addressed staffing challenges and the impact that such challenges have on a grantee's ability to fulfill the services that are proposed to CMHF. Responses also addressed that CMHF funding allows agencies to serve clients that they would not be able to otherwise serve, highlighting that CMHF has played a major role in creating agency capacity in the community for really not only sustaining and expanding services, but also expanding staff capacity through support for positions and knowledge building among professionals. Themes around the need for expanded use of funds also emerged, and responses revealed the critical role for the CMHF that the CMHF liaison plays, and also the importance of site visits. Lastly, responses revealed the support for local agencies to explore innovative practices. Again, if you have any questions regarding the findings that I've presented on in this presentation, the full report and full wording of questions is available on request. And this concludes part 1 of this final report.
On behalf of the study team, thank you for your interest.